121. What is the priority nursing action for a patient with MI and a troponin level of 3.0 nanograms per milliliter? Answer. Notify the provider and prepare for cardiac catheterization. Rationale. High troponin indicates significant necrosis, often requiring catheterization, per AHA/ACC guidelines. 122. What should the nurse teach a patient about ACE inhibitor side effects post-MI? Answer. Report persistent cough and swelling. Rationale. ACE inhibitors may cause cough or angioedema. Reporting ensures safety, per AHA guidelines. 123. What is the nurse's first action for a patient with MI developing acute left ventricular failure? Answer. Administer prescribed diuretics and oxygen. Rationale. Left ventricular failure causes pulmonary edema. Diuretics and oxygen relieve symptoms, per AHA heart failure guidelines. 124. What should the nurse monitor in a patient receiving rivaroxaban for MI? Answer. Monitor for bleeding and renal function. Rationale. Rivaroxaban, an anticoagulant, risks bleeding and is renally cleared. Monitoring ensures safety, per AHA guidelines. 125. What is the priority nursing action for a patient with MI and chest pain after stent placement? Answer. Notify the provider and administer prescribed nitroglycerin. Rationale. Post-stent pain may indicate restenosis. Nitroglycerin and notification address ischemia, per AHA/ACC guidelines. 126. What should the nurse do for a patient with MI and a history of alcohol abuse? Answer. Refer to substance abuse counseling and monitor for withdrawal. Rationale. Alcohol increases cardiac risk. Counseling and monitoring aid recovery, per AHA secondary prevention guidelines. 127. What is the nurse's first action for a patient with MI showing ventricular ectopy on telemetry? Answer. Notify the provider and assess for hypoxia. Rationale. Ventricular ectopy may indicate ischemia or hypoxia. Notification and assessment guide treatment, per AHA guidelines. 128. What should the nurse teach a patient about dietary sodium post-MI? Answer. Limit sodium to 2,000 milligrams daily. Rationale. Low sodium prevents fluid retention and heart failure, per AHA dietary guidelines. 129. What is the priority nursing action for a patient with MI and a heart rate of 130 BPM? Answer. Notify the provider and administer prescribed beta blockers. Rationale. Tachycardia increases myocardial demand. Beta blockers and notifications stabilize the heart, per AHA guidelines. 130. What should the nurse monitor in a patient receiving Retaplace for STEMI? Answer. Monitor for bleeding and allergic reactions. Rationale. Retaplace, a thrombolytic, risks hemorrhage and hypersensitivity. Monitoring ensures safety, per AHA/ACC guidelines. 131. What is the nurse's first action for a patient with MI complaining of back pain? Answer. Assess the pain and obtain a 12-lead ECG. Rationale. Back pain may indicate atypical MI. ECG and assessment confirm ischemia, per AHA symptom guidelines. 132. What should the nurse do for a patient with MI and a family history of diabetes? Answer. Monitor blood glucose and educate on risk reduction. Rationale. Diabetes increases MI risk. Monitoring and education prevent complications, per AHA guidelines. 133. What is the priority nursing action for a patient with MI and a new left bundle branch block? Answer. Notify the provider and prepare for pacemaker insertion. Rationale. LBBB may require pacing to maintain cardiac output, per AHA arrhythmia guidelines. 134. What should the nurse monitor in a patient receiving propranolol for MI? Answer. Monitor for bradycardia and bronchospasm. Rationale. Propranolol, a beta blocker, slows heart rate and may constrict airways. Monitoring prevents complications, per AHA guidelines. 135. What is the nurse's first action for a patient with MI and a troponin level of 0.2 nanograms per milliliter? Answer. Continue monitoring and repeat troponin levels. Rationale. A low troponin may indicate early MI. Repeat testing confirms diagnosis, per AHA biomarker guidelines. 136. What should the nurse teach a patient about cardiac rehabilitation post-MI? Answer: attend supervised exercise and follow the prescribed plan. Rationale: cardiac rehab improves recovery and reduces risk, per AHA rehabilitation guidelines. 137. What is the priority nursing action for a patient with MI and a potassium level of 5.8 milliequivalent/L? Answer: notify the provider and prepare for potassium-lowering therapy. Rationale: hyperkalemia risks arrhythmias. Notification and therapy stabilize the heart, per AHA guidelines. 138. What should the nurse do for a patient with MI experiencing cold sweats? Answer: keep the patient warm and monitor vital signs. Rationale: cold sweats indicate autonomic response to ischemia. Warming and monitoring prevent complications, per AHA supportive care guidelines. 139. What is the nurse's first action for a patient with MI developing right ventricular infarction? Answer: notify the provider and prepare for fluid administration. Rationale: right ventricular infarction causes preload-dependent hypotension. Fluids and notifications stabilize the patient, per AHA/ACC guidelines. 140. What should the nurse monitor in a patient receiving apixaban for MI? Answer: monitor for bleeding and liver function. Rationale: apixaban, an anticoagulant, risks bleeding and hepatotoxicity. Monitoring ensures safety, per AHA guidelines. 141. What is the priority nursing action for a patient with MI and chest pain unrelieved by morphine? Answer: notify the provider and prepare for PCI. Rationale: unrelieved pain suggests ongoing ischemia, often requiring PCI, per AHA/ACC guidelines. 142. What should the nurse teach a patient about beta-blocker therapy post-MI? Answer: report fatigue and take the medication consistently. Rationale: beta-blockers reduce heart rate but may cause fatigue. Adherence ensures efficacy, per AHA guidelines. 143. What is the nurse's first action for a patient with MI showing U waves on ECG? Answer: notify the provider and check potassium levels. Rationale: U waves suggest hypokalemia, risking arrhythmias. Notification and testing guide treatment, per AHA guidelines. 144. What should the nurse do for a patient with MI and a history of anxiety? Answer: provide relaxation techniques and refer to counseling. Rationale: anxiety increases myocardial demand. Support and referral improve outcomes, per AHA psychosocial guidelines. 145. What is the priority nursing action for a patient with MI and a new S3 heart sound? Answer: notify the provider and assess for heart failure. Rationale: S3 indicates fluid overload. Notification and assessment guide treatment, per AHA heart failure guidelines. 146. What should the nurse monitor in a patient receiving streptokinase for STEMI? Answer: monitor for bleeding and anaphylaxis. Rationale: streptokinase, a thrombolytic, risks hemorrhage and allergic reactions. Monitoring ensures safety, per AHA/ACC guidelines. 147. What is the nurse's first action for a patient with MI complaining of jaw pain? Answer: assess the pain and obtain a 12-lead ECG. Rationale: jaw pain may indicate referred ischemic pain. ECG confirms MI, per AHA's symptom guidelines. 148. What should the nurse teach a patient about cholesterol screening post-MI? Answer: monitor lipid levels regularly and follow statin therapy. Rationale: lipid control prevents reinfarction. Regular screening tracks progress, per AHA lipid guidelines. 149. What is the priority nursing action for a patient with MI and a heart rate of 50 BPM? Answer: notify the provider and prepare for atropine administration. Rationale: bradycardia reduces cardiac output. Atropine and notification stabilize the heart, per AHA ACLS guidelines. 150. What should the nurse do for a patient with MI experiencing hopelessness? Answer: provide emotional support and refer to mental health services. Rationale: hopelessness impacts recovery. Support and referral improve mental health, per AHA psychosocial guidelines. 151. What is the nurse's first action for patient with MI showing ST depression in multiple leads? Answer: notify the provider and administer prescribed oxygen. Rationale: diffuse ST depression suggests STEMI or ischemia. Oxygen and notification guide treatment, per AHA/ACC guidelines. 152. What should the nurse monitor in a patient receiving dabigatran for MI? Answer: monitor for bleeding and renal function. Rationale: dabigatran, an anticoagulant, risks bleeding and is renally cleared. Monitoring ensures safety, per AHA guidelines. 153. What is the priority nursing action for a patient with MI and a new onset of dizziness? Answer: assess blood pressure and notify the provider. Rationale: dizziness may indicate hypotension or arrhythmia. Assessment and notification guide treatment, per AHA guidelines. 154. What should the nurse teach a patient about antiplatelet therapy adherence post-MI? Answer: take the medication daily and report unusual bleeding. Rationale: antiplatelets prevent clots but increase bleeding risk. Adherence and reporting ensure safety, per AHA guidelines. 155. What is the nurse's first action for a patient with MI developing post-infarction angina? Answer: administer prescribed nitroglycerin and notify the provider. Rationale: post-infarction angina suggests ischemia. Nitroglycerin and notification address symptoms, per AHA guidelines. 156. What should the nurse do for a patient with MI and a family concerned about lifestyle changes? Answer: provide education on heart-healthy habits and refer to support groups. Rationale: education and support ease family concerns, improving adherence, per AHA psychosocial guidelines. 157. What is the priority nursing action for a patient with MI and a blood pressure of 180/100 mmHg? Answer: administer prescribed antihypertensives and notify the provider. Rationale: hypertension increases myocardial demand. Antihypertensives and notification stabilize the patient, per AHA guidelines. 158. What should the nurse monitor in a patient receiving eplerenone post-MI? Answer: monitor for hyperkalemia and hypotension. Rationale: eplerenone retains potassium and lowers blood pressure. Monitoring prevents complications, per AHA heart failure guidelines. 159. What is the nurse's first action for a patient with MI showing atrial flutter on telemetry? Answer: notify the provider and prepare for anticoagulation. Rationale: atrial flutter increases stroke risk. Anticoagulation and notification prevent thromboembolism, per AHA arrhythmia guidelines. 160. What should the nurse teach a patient about managing stress post-MI? Answer: use mindfulness techniques and avoid high-stress situations. Rationale: stress increases myocardial demand. Mindfulness reduces risk, per AHA psychosocial guidelines.